Thyroid imaging and therapy, hyperthyroidism. Welcome to the Nuclear Medicine Department in IU Radiology. This video will provide you with a quick overview of thyroid imaging and the treatment of hyperthyroidism. Based on a combination of your lab tests and symptoms, your physician has diagnosed you with hyperthyroidism, which means your thyroid overworks and puts out too much thyroid hormone. The imaging test we will start today will help confirm the cause of your hyperthyroidism. In addition, you are watching this video because your physician has ordered a radioactive treatment for your hyperthyroidism. We cannot be sure if you will actually be treated until we've completed your scan, but please listen to the following information so we can answer any questions you may have. An overactive thyroid can be caused by several illnesses, including Graves' disease, multinodular goiter, and solitary autonomously functioning nodules. There are other causes of hyperthyroidism, but these are the most common causes that we diagnose and treat in nuclear medicine. There are a few options for treatment of hyperthyroidism. Surgical removal of the entire thyroid gland is one option. Another is controlling the hyperthyroidism with medication. And finally, using radioactive iodine to destroy the gland is another option and part of the reason you are here today. Generally, two types of radioactive iodine are used. Iodine-123 is used for diagnostic purposes to visualize the thyroid gland. This does not put out radiation that affects others. However, iodine-131 is used for both diagnostic and therapeutic purposes. Here at IU, we use this for therapy only. Iodine-131 does put out radiation that may affect others, so we will talk about taking precautions to reduce exposure to other people later in this video. This will be a 2-day process. Iodine-123 is given on day 1 via oral pill. Remember, this radiation dose does not affect others, so when you go home today, you don't have to do anything differently. Tomorrow, we will perform a scan and we will measure how much iodine is in your thyroid. This is performed with a gamma camera and probe. This is the gamma camera we will use to perform your iodine-123 thyroid scan, which usually takes about 15 to 30 minutes. After the scan, one of our IU physicians will review the images and the amount of iodine your thyroid takes up. This will confirm the cause of your hyperthyroidism and allow for the calculation of an appropriate dose of iodine-131 for your treatment. This is an example of an iodine-123 thyroid scan in a patient with Graves' disease. Your iodine-131 treatment dose is then ordered by a nuclear medicine technologist. It takes about an hour to receive the dose from the pharmacy. During that time, an IU physician will discuss the scan and treatment with you, in addition to answering any questions you may have. This radiation can affect people around you, so the physician will also discuss with you in detail how you will need to change your behavior around other people. You will also receive paperwork with these instructions to take home with you. When the I-131 capsule is ready, the technologist will give that to you. This is also a pill taken orally. Remember, this radiation can affect others, so use precautions in interacting with other people. That's the general process. Before you receive the iodine-123 for imaging, we want to make sure you haven't been exposed to anything that may limit the sensitivity of our test or make your treatment less effective. Have you stopped medications such as methimazole, PTU, multivitamins, and amiodarone? Have you had iodinated contrast recently, for example, from getting a CT scan, cardiac catheterization, or interventional radiology procedure? If you have received any of these medications or have had any imaging study with CT contrast recently, please let the radiology technologist know. If we determine you are a candidate for radioiodine treatment, there are special situations to consider. You should not undergo treatment if you are pregnant, and you should not become pregnant within 6 to 12 months of treatment. If you are a woman of childbearing age, we will need to perform a urine pregnancy test unless you have had a hysterectomy or tubal ligation. You also should not breastfeed after receiving radioactive iodine therapy. You will only be treated after you have discussed all risks and benefits with one of our physicians and it has been determined that there are no contraindications, such as pregnancy. When you are comfortable with moving forward, the radioactive iodine treatment dose will be given to you. But what happens after that? After you've received the iodine-131 capsule, there are 3 major goals. Number 1, absorb as much of the radioactive iodine as possible. Number 2, get rid of iodine that doesn't stick in your thyroid. Number 3, limit radiation exposure to other people. So how do we maximize absorption of the radioactive iodine? You should not eat or drink for 1 hour prior to taking the capsule and for the 2 hours following. This is so that your stomach absorbs as much of the radioactive iodine as possible. A small amount of water is acceptable. Once you're 2 hours out from taking the capsule, you can eat a regular diet. So we've given your body time to absorb the radioactive iodine. Now let's talk about getting rid of the radiation that isn't sitting in your thyroid gland. Radioactive iodine is primarily excreted in urine within the first 24 hours, but also leaves the body via sweat, vaginal excretions, saliva, stool, and other bodily fluids over the next 1 to 2 weeks. For that reason, you must remain well hydrated over the next few days. So drink plenty of fluids and urinate frequently. If you are prone to constipation, take a gentle laxative to help remove radioactive iodine from your stool. Now let's talk about safety precautions. In addition to keeping you, the patient, safe, it is important to try to minimize the radiation exposure to those around you. This is essential, especially for young children less than 12 years old and pregnant females. Minimizing the radiation dose to others is centered around decreasing time spent with them, increasing your distance from them, and practicing good hygiene. You will get specific instructions based on the dose of radioactive iodine you receive. You will have those in writing before you leave the nuclear medicine department. A good rule of thumb is to act as if you have the flu. The less time you spend around others, the less radiation they will receive. Avoid spending more than a few minutes near other adults within 4 feet. Your doctor will recommend staying home from work for a few days depending on the type of work you do and the dose given. Avoid prolonged close contact with children under 12 and pregnant women for at least several days. Avoid kissing and sexual intercourse for at least 7 days. Next, the farther you are away from someone, the less radiation they will receive. This includes pets. Sit as far away as possible from other passengers or drivers on the ride home. Avoid public transportation. Sleep in separate bed for several nights. Again, maximize your distance greater than 6 feet from children and pregnant women. Avoid places where you might be close to people for long periods of time. If going to religious services, sit away from others in the back or in the balcony. Again, you will receive specific instructions detailing how long you should practice these precautions before you leave our department. Lastly, practicing careful hygiene will help minimize radiation to others. Just like when you have the flu, frequent hand washing is recommended. It is recommended that you use separate bathrooms and not share toiletries. The toilet should be flushed a couple of times after use, and men should also sit down while urinating in order to minimize splashing. Avoid preparing food for others and use separate utensils and dinnerware when eating. Wash your laundry in separate loads. Lastly, dispose of waste such as tissues immediately. A separate closed trash container is recommended to prevent children and pets from digging through. Let's review what we've already talked about. Imaging your overactive thyroid gland with iodine-123 and confirming the cause of your hyperthyroidism. We've reviewed your treatment options, we've reviewed contraindications to treatment, and we've gone over the treatment itself. For example, how to behave afterwards to maximize treatment and minimize radiation exposure to others. So now let's go over some frequently asked questions. Will this hurt? Some patients have a sore neck or sore throat a few days after treatment. We recommend you take over-the-counter pain medications for any pain and/or swelling. This helps the majority of patients. If you have pain that does not improve, difficulty swallowing, or difficulty breathing after the treatment, please go to the nearest emergency department or call your physician. Will I feel differently? Most patients don't feel any different after treatment. There are some patients who spill out more thyroid hormone starting 2 to 3 days after treatment, which makes them feel worse for a short time. This should improve over the course of 1 to 2 days, but if it doesn't, please go to the nearest emergency department or call your physician. Does this cause sterility? No, the treatment dose of radioactive iodine you will receive will not cause sterility. Will I have to take medicine after the treatment? Yes. If we end up treating you with radioactive iodine, you should understand that our goal is to get rid of your thyroid gland entirely. This means your body will not make thyroid hormone. But you do need thyroid hormone to live, so you will need to take a thyroid hormone pill, which will be prescribed by your doctor. Is there a chance this won't work? It usually takes 3 to 4 months for your physician to determine whether the thyroid gland has been destroyed. There is roughly a 1 in 10 chance this won't work. If that's the case, your physician may put you on an anti-thyroid medication, either methimazole or PTU, for a while and then consider performing another treatment with radioactive iodine. That's okay, and it is rare for a second dose of radioactive iodine not to work. A second treatment will not be considered for at least 6 to 12 months after your first treatment. This gives the first dose the maximum amount of time to work. Will radioactive iodine make me glow? No, you will not glow. You will not look any different, and most patients don't feel any different. Remember though, you do have to try to maximize distance and minimize time with other people to reduce their radiation exposure. The last topic we will discuss is post-therapy follow-up. It is essential to have close follow-up with endocrinologists within a few weeks after receiving radioactive iodine therapy. As previously discussed, this treatment will slowly cause hypothyroidism, and lifelong thyroid hormone replacement will be necessary. In addition, regular close follow-up will be needed to make any adjustments to your thyroid hormone dose. The endocrinologist will also monitor symptoms and thyroid hormone lab work to make sure the treatment was successful. This concludes our overview of thyroid imaging, information regarding radioactive iodine therapy, and post-treatment guidelines. We hope this has been helpful. One of our nuclear medicine technologists will be with you shortly. The technologist will ask you questions regarding some of the things we've already discussed in this video. Please answer to the best of your ability and feel free to ask any questions. If you would like to speak with one of our physicians, please let the technologist know. And if you would like to watch this video again, just let us know. Thank you for watching, and thank you for choosing IU Radiology.